I'm Dr. Kevin Kaplan from the Jacksonville Orthopedic Institute and head team physician for the Jacksonville Jaguars. I'm here at the JCA, Jewish Community Alliance, giving a talk about shoulder injuries, shoulder symptoms, and how we treat them. The goal of the talk is to define the basic anatomy of the shoulder, bring it down to a level that patients can understand, and go over the different signs and symptoms of shoulder pain, the different diagnoses that I see in my office, and how I treat them. So when it comes down to it, after I do a physical examination, I've done all the tests and trying to figure out what's going on with the shoulder, I have to come up with a differential diagnosis. And so we'll run through some of these, does anybody in here, has anybody had a rotator cuff tear in here? All right, so there you go. Wow, all right. Oh, there you go. All right, see, that you are my patient. I knew we planted him, he's a plant. So we'll go over all these diagnoses I always, whenever I give talks about injuries and shoulders, I always, a lot of patients will start nodding their head because I had this. So if you have these symptoms, I'm watching. All right, so labral tears. Again, what we talked about, a patient who lands on an outstretched arm or gets their arm pulled out of socket, let's say you unfortunately slip and fall and land on your shoulder, the ball can actually pop out of the socket. It can move out of the socket a little bit and come back into place, which is called a subluxation. And what that can do is it can take that golf tee that we talked about and knock off a piece of the tee or knock off a piece of the cartilage around it. So if I was to take a golf ball and put it on half of a golf tee, what would inevitably happen? It would roll off, right? And that's how I describe shoulder instability to patients. When they say, I feel like my shoulder moves out of place, or I feel like it rolls a little bit, they're probably describing some instability in the shoulder because they've lost that socket that's holding the ball in place. And that can happen, like I said, from a traumatic fall or landing on an outstretched arm, or just some subtle motion in the shoulder, abnormal motion in the shoulder that's caused a tear in the labrum. So once I do the test and say, hey, this patient may have a labral tear, may have an instability, I get what's called an MRI, a magnetic resonance imaging. And that's the best way. X-rays really only show us the bone, whereas MRIs are the best way to look at the cartilage, the ligaments, and the rotator cuff tendons. So what we typically do is order an MRI arthrogram. An arthrogram means that there is fluid injected into the shoulder joint, and the fluid in the joint will help me determine where there's a tear. So when a labrum is torn, or when a piece of cartilage is torn in the shoulder, it's not like the cartilage is, the bone's here and the cartilage is way away. It's still sitting close to where the bone is. And so a plain MRI may not give us the best look at if there's a tear or not. When you put fluid in the joint, what happens is the fluid can actually leak between the cartilage and the bone, as you see here. Here's that cartilage here, and it will then show us that there is a tear of that cartilage. And so this is the best way to identify what we have in this patient, which is an anterior labral tear. So you have symptoms of shoulder pain and you need more information, come visit us online, joi.net. You can see me at my website, www.kevinkaplanmd.com, to learn more about the shoulder. If you have symptoms that don't go away, pain at night, pain when you lift your arm over your head, clicking, popping, come and see us at JOI. We'll be happy to help.